A medical procedure or trip to the ER can be scary for someone at any age, but that fear and confusion is likely to be worse for a child. That's why Beacon Children's Hospital and Memorial Hospital offering services from a position that you've likely never heard of, a child life specialist. WSBT 22's Ann Laree sat down with one of those professionals and found out the importance of their role in this month's Eye on Health.
Beeping, needles, and a room full of strangers. It all sounds like a nightmare for a kid. And the thought of undergoing a surgery or any other kind of procedure, even scarier. That's until someone can come in and explain to a child what's happening. The Child Life program at Beacon Children's Hospital started almost 20 years ago, initially serving patients in pediatric and pediatric intensive care. Today, these trained professionals also work in pediatric hematology, oncology, the emergency department, and surgery.
Of course, pediatric nurses try to be as compassionate and comforting to children when they're in the hospital as possible. But when we added the Child Life team, it really helped us to learn to speak a different language, to use positions of comfort. And the goal is really to decrease that fear and anxiety so that kids are not afraid to have to come back to the hospital.
The Child Life Specialist comes in and bridges that gap for the child, taking things that might seem scary and making them simple.
So a lot of it is just rephrasing terminology. They're very literal thinkers, so trying to be careful about using like euphemisms and things like that, and using the real terminology, but then explaining it in ways that developmentally I know that they can actually understand.
Chloe Taylor is a Child Life Specialist.
This is our skin straw. This is what's going to help our body get drinks of medicine.
And that's how she explains IVs. She says it's all about telling the child what's happening in a way they'll relate while making the process a little more comfortable. She adds that you can often do that by giving the child back the power of choice.
So maybe we're listening to some music. Maybe we're watching a movie on an iPad. Maybe we're playing a game if the kids are able to be in a position that would allow them to use their hands. Usually they're a lot more comfortable because they're not hearing the adult big words and the big hospital terminologies that gets kind of thrown around.
And she even has some unique tools to do it.
This is my CT scanner machine. Talk about how they're going to go and see this big white circle camera with a bed. They lay on their bed and they go inside that circle camera and they come right back out. Sometimes I'll stick a Barbie through there so they can kind of picture it themselves.
In turn, she says the child starts to relax, answering the doctor's questions and even becoming more cooperative with them. Memorial is the only hospital in the area with Child Life services, and the program is supported entirely through community donations, which means families don't pay a dime for their help. Help, Taylor says, can make a world of a difference.
I love seeing on a kid's face when they accomplish something that was just so scary for them, something that was so fearful for them, and they saw that they were able to do it.